Why VO transthoracic? So here we go. Before I do anything, I have to change this twice, right? And I'm gonna bring her towards me or away from me.
Yeah.
So ma'am, are you, no C-spine precautions? Okay, so go ahead and turn that way without holding now. You know already how to place that 45-degree sponge, right? Right here. Go ahead and relax. Okay. And then, what did I tell you about this, the acromion? And the arm needs to be like right here. There you go. So, I want you to see, tell me if these are superimposed according to what I just showed you. Let me bring this back up. So I want you to come in here and tell me if you just off the, just try to see if you can feel for the borders. Anyone? Not yet? Not yet?
Can
So I'm
you help
going
me?
to show you.
Can you help me? I'll just watch.
So I'm going to show you. I'm going to be back over here. And I already can tell, come back over here closer, I won't get you sick, I won't speak. But pay attention to the border of the sponge. Now, your acromion is here. Your medial border of the scapula, for what you know already, is probably just by off the top, you know it's about right here. So see the difference? They're not superimposed. So the trick is, go ahead and roll forward a little bit. And you're gonna flip this 90 degrees and then turn a little more, and then hook it right into the medial border and let it rest back. The weight of your patient in the sponge will bring you to what you need to be. So now, watch this. That's my acromion, remember, halfway? That's my acromion, right? Approximately, that's the middle. And then my medial border is right here, so they're all in the same place. Get it? So it's a lot easier to do this ones on the back. Okay, any questions? Later on we'll practice. When you're practicing, I'm gonna have you feel for both borders. This one and this. Now, go ahead and relax for a minute. We're gonna take this up. There's a thing where Miss Sherman is really good about finding the scapula like this and aligning. I can never find it, but you can try. I can feel the medial, but the other one I can never find. Okay? That's another way they're gonna be like, oh no, do it this way. Now, relax back for me, please. Now, the next thing we're gonna do is the cross transthoracic for trauma. Remember, we're not doing Gracie. Why am I not doing Gracie in trauma?
I'm gonna roll her on the shoulder.
Right, I'm not gonna roll her like this, right? If they order Gracie, I might just do it standing, but I don't think they would. This is trauma series. So this is the affected side. So therefore, where should I put my grid? On which side?
The affected side.
Yeah, so the patient should be against the bucky, if I'm doing it through the bucky, on this side. So let's, oh, thank you. That's fine, this is good. I'm gonna use 14 by 17 because that's most likely what you're gonna be using for when you are in clinic. Sorry, this might hurt a little. Notice how I'm gonna do this?
You want me to turn the other way so that you do this way?
No, because I'm already working on the shoulder, so that's fine, no worries. So now look at this. I'm just gonna bring her closer to me. Put my patient like that. And I'm gonna use a really good tape if you were doing this on gurney. But at your level of trauma cases, most likely this will be done against the bucky. Because, you probably don't want to drop this guy up. I'm gonna need a volunteer to hold this for me here because I don't want to drop it. Okay, just so I can demo for her. So, what should I do now? Do I elevate her into a sponge, or do I, what do I do? Don't I want that right in the middle of my IR?
Yeah.
Okay, so what happens if you cannot move your patient because you're in C-spine precautions? You cannot lift them, you cannot do anything.
Oh, angle? You angle or no?
Well, Because right now, in order for me to bring the affected arm right in the middle of my IR, I will have to raise her up a little bit on a support. So if she's okay to raise herself up a little, I'm gonna put a little pillow, and before she lays down back again, now what happens? Now I'm more at the middle of my IR. But this is level, like second years, when you start working with patients on gurneys like this. Assume this is your bucky, okay? Then you can raise the bucky up and down and try to put it in the middle. If your patient cannot be moved. If your patient can be moved safely, then you do what I just did. If not, your other choice just will be just to bring hopefully you get enough padding underneath to get the cross stable. Okay, never attempt to move your patient just because you learn it like this. Remember, trauma cases are very, especially if they have C-spine precautions. So what we're gonna do here is I'm gonna look at my arm right here. Notice how both shoulders are on the same plane, right? My middle of my IR is about the surgical neck, okay? So I'm gonna look at this. This will be my guide here. And this is gonna make more sense for you, Anisha, now, look. If I enter right in the middle, see right my surgical neck, I'm using this arm, I'm gonna column A. Am I getting enough over the neck? Yes, to include the humeral head, yes, see, you can see your, always look at over there, over there. There you go, you see that?
Yes.
Okay, so it looks like I'm doing a picture of this arm, right? But in reality, I'm doing that one. So I'm gonna throw my marker right in there. Oopsie. Okay, my marker will go right here. And ma'am, can you raise your arm above your head now? Oh, thank you. There you go, you see that? Now you can always do a little adjusting. Maybe you wanna bring this just a little bit, you might not want that much. Let's say the injury kind of runs low on the proximal humerus, so you can adjust, but your goal is to cover the head of the humerus. You must include in a little bit of a spine in there. Not the whole neck, just a little bit. So now you see that's your transthoracic. It can be done breathing technique or just normal technique. In clinic, I know a lot of equipment doesn't have breathing technique options. And that's how you do. That's your transthoracic. Go ahead and relax now. That's it. Am I missing anything? Yeah, we did that one. We're done. Any questions?